This panel, we already talked about it a little bit, what it's about, Texas programs and policy updates. We don't have firm unwinding numbers from Texas Health and Human Services yet. What we do know, thanks to our partners, one of whom is on this phone right now or on this call right now at Texans Care for Children, some really good research about the number of people who have lost coverage. And then we do have some info about current determination delays from the Health and Human Services Department. So unfortunately, right now, application wait times for people who are filling out SNAP food benefits applications or Medicaid applications are actually getting longer rather than getting shorter. There are many factors contributing to that length, including recent natural disasters that we've had in Texas, where people had to request new SNAP food benefits. Also, application backlogs, of course, that are still left over from the unwinding period. But in general, the unwinding period is officially over, but I think everybody on this call knows that it won't be really over anytime soon. It is projected that about 400,000 children, these are just children in Texas, are eligible for Medicaid, but are not enrolled. And about 700,000 people may have lost Medicaid during the unwinding period who should probably still be on it. So we still have a lot of work to do. And the Health and Human Services Department is fully aware of the determination delays, and they are developing some of their own strategies to try to deal with needing to speed that process up for Medicaid and SNAP applications. We have Amy Cuellar from Feeding Texas on this call today, who will talk a little bit more about SNAP. And then we've also got some updates today on our Healthy Texas Women program, which is not a Medicaid or a CHIP program, right? But is a family planning program for adults. And all of these programs are connected, so if it's possible that, two people in a household could be on Healthy Texas Women, one could be on Medicaid, one could be on CHIP, and they could all have access to SNAP food benefits, right? So all of the interconnections between these programs are really important, and really, really grateful again to our panelists today for speaking on these important topics. This slide here is just a brief overview of what this link here at the bottom has in it, which is just ways for community partners to follow up with clients as you're filling out those SNAP and Medicaid applications so that you can help folks get into those programs as quickly as possible, including submitting all the documents that you need to submit with those applications when you submit them, right? Don't submit an application without including income verification. You'll just get a note back from HHS that says, please submit it. Follow up on all applications after 45 days. Make sure that you're checking with HHS saying, what's the status of this application? Work with a community partner program. If you feel like there is a delay or an escalation that's needed to get an application reviewed more quickly, Tier 3 partners, and you can see Tier 3 partners at this link here, for Texas Community Partner Programs can all do those escalations. And then beware when you're looking at that list of community partner programs, of course, also do make sure that it is up to date, or that those offices in there are actually operating before you send a client there. A lot of people on this call are already members or staff of community partner programs, so that's all old news to y'all, but just for anybody who's not, who might be a community health worker new to the community partner programs watching this call here today. And then also, there are so many helpful community organizations that serve as navigators. And here in this sense, I don't mean like the official CMS funded navigator, but rather like community programs navigators. So just folks who help you navigate the system. There's a long list here. We've got Texas Community Partner Programs, federally qualified health centers, actual CMS certified and funded navigators, certified application counselors, which do the similar work, area agencies on aging for people who are connected to Medicare or Medicare beneficiaries, Veterans Affairs centers for folks who are on TRICARE. I didn't even add it on here, but refugee resettlement organizations and the Texas Office for Refugees and Immigrants. And then, of course, every Texan down there at the bottom, supporting the network with coalitions and advocacy and so forth. And here is just a list of some of Every Texans coalitions. We have gotten a lot of questions from attendees just today in this conference where we said we'll update the network of community partners. Anybody who's on this call, everybody is welcome to join the Get Covered Texas Coalition or the Seguro Texas Coalition, focused on increasing coverage rates in Texas for Get Covered, and for Seguro Texas on minimizing the effects of chilling effects. Minimizing the consequences of chilling effects, and trying to make sure that our immigrant community members have access to the supports and the people that they need to have accurate information about what programs they're eligible for and what does and does not affect their immigration applications. And big hint, most access to programs like Medicaid, Children's Health Insurance Program, charity care in hospitals, those things do not affect immigration applications. They are not subject to public charge admissibility tests. And now we will start with Diana Forrester from Texans Care for Children, and I will mute myself. Diana, thank you so much for being here.
Thank you, Lynn. I'm gonna jump right into it. If you want to go to the next slide. So I'm going to talk about HB 12 implementation. That's the biggest change that we have to our maternal health Medicaid policy for new moms. You can go to the next one. Before I jump into that, I'm going to talk a little bit, just want to give you an idea of the organization I work with. We're called Texans Care for Children. We're a statewide advocacy and policy research group. We cover several areas. My team does maternal and child health, but we also cover early childhood, mental well-being, and child safety and protection. And just, I think it's always good to ground ourselves in our vision, where we envision a Texas where all children can grow up to be healthy, safe, successful, and on a path to fulfill their promise. You can go to the next one. So I'd like to start talking about maternal health in Texas from the lens of our uninsured rate. We have one of the highest uninsured rates in the nation, and this is true also for our women of childbearing age. 1 in 4 Texas women are uninsured, which means about 1.5 million women ages 18 to 44 do not have insurance. It is the highest rate in our country. It's actually twice the national average. And it means that our Medicaid ends up paying for half of the births in our state, because those women don't have insurance, and when they become pregnant, they become eligible for Medicaid for pregnancy, which covers them for their prenatal, their birth, and now it covers them for their 12 months postpartum. You can go to the next one. So we've been working on this, getting this extension. Historically, Medicaid for pregnancy has covered prenatal, the birth, and just 2 months postpartum. And so 60 days after you have that baby, you're going back to being uninsured. And we've been working on this policy issue area for 3 sessions, almost a decade. And last session, they finally passed HB 12, which extended that coverage to the 12 months postpartum. Just because it was effective in the bill September 1 doesn't mean it went into effect then. So the agency had to do a lot of behind the scenes work to get that up and running. And so as of March 1st of 2024 is when that benefit became live, essentially. And so anybody that was on Medicaid for pregnancy, as of March 1st or after, should automatically be connected to that 12 months of postpartum coverage. Additionally, the agency was trying to, get anybody that was still kind of in that postpartum period that was still eligible for a few extra months. They automatically turned their coverage back on. I'm not sure how many people really realized that was happening, but they were trying to make that benefit as applicable to as many people as possible. And you can see this map, and last time I presented to this group, it was not all blue like that. And look how blue it is. That means all of the states that are blue have done this 12-month extension. So you can see that it's like the majority of our nation now. This is becoming the norm to give moms actual health insurance to recover for that year after birth, which I think is phenomenal. You can go to the next one. So I just wanted to highlight a few implementation issues that we have seen since, this benefit went live on March 1st. There have been some provider claims that have been inaccurately denied because they said they needed to be pregnancy related. We have sent examples of these to HHSC and they have supposedly fixed this, but if you are working with a client whose doctor is telling them, oh, I tried to submit this claim and I got denied, like that should not be happening. And so they do need to appeal that. So please don't take that notification as proof that they shouldn't have coverage. They absolutely should. It's an error and you have to report this back to HHSC so they can fix it. Additionally, these notices went out for our CHIP P moms that because of the extension, they were eligible for emergency Medicaid for 12 months postpartum. This is not correct. It should not have happened. Unfortunately, the 12-month extension is only for our moms that are on Medicaid for pregnancy. It does not apply to the CHIP P program. And as Lynn was talking about the backlog of applications, new applications are taking several months to get approved because of that backlog. If you are applying for Medicaid because you are pregnant, they are supposed to expedite that application within 15 days. So if you are working with a mom who is applying for Medicaid because she is pregnant, and it has been more than 15 days since she has heard back from the agency, we need to escalate that. We need to call 211, and there's an email on the next slide that you can email case information and to try to get that case escalated, because that for our pregnant moms, we want them enrolled as quickly as possible so they can start getting those prenatal visits. You want to go to the next slide? So these are just a few graphics that are really emphasizing what Lynn was talking about earlier about the Medicaid backlog. We did have that unwinding that happened last year of the agency had to process renewals for everybody that was on Medicaid due to the public health emergency. It was like 6 million renewals. We really expected after that was done to see this backlog start decreasing. And you can tell from March to May, it did decrease significantly. And then it's been steadily rising since then. And so the graph on the left, you can just see the decline and then it's rising again. And then over here on the right, the application timeliness. This is a slide from HHSC. As of September 6th, they had 220,644 uninitiated applications in queue. That means people have applied for Medicaid and the application is just sitting there. It hasn't been touched by a worker. Go to the next one. So these are just a few resources I really wanted to highlight on this issue. That top link, there's a website that HHSC has created specifically about this postpartum extension. If you go to that website and you scroll all the way down, at the bottom, there's a bunch of links. They have a toolkit. They have a one-pager flyer that talks about who is eligible and what is covered. They have a webinar for docs if they want to get a little bit more information on like when this happened and who is covered also. So these are things that you can share. I put that flyer as the middle bullet as a separate thing. I think that this is a really great, thing you could print out and hand to somebody so that they could concretely understand what this benefit is and how they are eligible for it. And then that last bullet, I really want to emphasize that email address update at hhs.texas.gov. If you have somebody that has applied and they're pregnant and they have not heard, and it's been over 15 days, please email that email address to try to get the case escalated. I think that is all oh yeah, continuous coverage, sorry. Okay, last one. This is an issue. If you've been working in the Medicaid realm for a while, you're very familiar with these periodic income checks, but essentially, historically, Texas has rechecked eligibility for kids that are on Medicaid starting in the 6th month, and then they recheck it every month, 6th month, 7th month, 8th month, 9th month. It's crazy. It was causing a lot of kids getting terminated because they just weren't replying to this notice. And then they were finding out that they didn't have coverage when they went to the doctor and they would have to reapply. So it was causing all these gaps in coverage just because the agency was doing these periodic income checks. At the federal government finally at the end of 2023, passed legislation requiring 12 months of continuous coverage for all kids. What does that mean for Texas? It should have gone into effect at the beginning of this year, January 2024. So if you're a kid on Medicaid, you should not have to prove your eligibility again until it's been 12 months. If they're getting some sort of notice, that should not be happening, and it's an error. It needs to be escalated to HHSC. But if all kids on Medicaid should get the 12 months continuous coverage, and that should be in effect now. Additionally, there's some new rules that came out that for CHIP is that states cannot terminate them for failure to make their copay. And I know that this has been an issue for a long time. They do, put kids on CHIP. You have like a 45-day grace period where they send you the information and say, hey, your copay is going to be this much. You have to pay by this date. And if you don't, we're going to terminate your coverage. Well, the feds are now saying you can't terminate their coverage for failure to pay. You just have to keep trying to get them to pay it. HHSC has not said when that's going to go into effect, but that should be coming this year. And that is all I had.
Awesome. Thank you so much, Diana. We do have a couple of questions for you. Let me get over here. As always, because this is very complicated stuff, many of them have multiple parts in these questions. But we'll go ahead and see if we can't just get to a couple of them. One person asks, why wait so long to follow up on an application? I think this question is actually for me, from that one slide that I shared, because it had follow up with HHS after 45 days. And that is an excellent point. You do not have to wait 45 days to follow up with Health and Human Services after you submit a Medicaid or a SNAP application. So if you have bandwidth, like if you're a parent or if you are a community partner program or some other kind of assister, and you have bandwidth to reach out to your clients and say like, hey, it's been 20 days since we submitted your Medicaid application. Have you heard anything yet? Has anyone called you and requested an interview for SNAP? If they say no, and if you have time, like absolutely call HHS and just say, what's the status? I'm just checking on this application. Any opportunity that staff at HHS have to like actively engage with an application increases its likelihood of being determined within the 45-day federal standard processing time. I only wrote 45 days on that slide because that's the maximum time. And then after 45 days, you can call in and you can use the word escalate and say, it's been 45 days at this point. I want to escalate this application so that somebody looks at it more quickly. That said, it's a 30-day standard processing time for SNAP. So you can call in about a SNAP application even sooner than you can call in about a Medicaid application. So that's a really good question. Excellent point. I'll make sure that slide is more clear. And then for Diana, let's see here. This is a great thing for expecting moms, right? As far as the 12-month postpartum eligibility. Who is eligible as far as age? And I think the question is there, like, does somebody have to be maybe like over 18 to be eligible for the 12 months Medicaid? And we'll go ahead and yes, let's start with that one.
Yeah, so that's a great question. I think it's 18 to 44, right? For our pregnant women's Medicaid.
Mm-hmm.
Yeah, if you're a child, you would be in CHIP, and then it's like full coverage. So everything would be covered anyways, if that makes sense. Or if you're in a different if you're in like Medicaid for children too, it would cover everything you need. It just wouldn't be specific to pregnancy. So yeah, you should still get like the 12 months postpartum, but if you're in Medicaid, just because you're a kid and you qualify, you would be in it anyway. Does that make sense?
Yeah, you don't like transition over to Medicaid for pregnant people if you're already in Medicaid for folks who are under 18 years old. So you would just remain in your Medicaid program. And then the second part of this question is one that I don't think any of us have the answer to, but it is, if you live in a household with someone whose income makes you ineligible for SNAP food benefits, which is, it's different for Medicaid, right? But so the SNAP application and the Medicaid application does take into account other people who are not necessarily in your tax household, but who contribute money to your home in some way. both Medicaid and SNAP applications ask about all of those folks who are contributing any kind of income to a household. And so the question is basically like, is there a way for us to change that? Can we make the income rules more streamlined, so that families don't have to consider like outside sources of income that might be coming from a temporary roommate or maybe a family member who's offering some temporary support to somebody who's having a kind of low income period?
That is also a great question. You know, the Affordable Care Act, when it went into effect, really standardized the eligibility criteria for all states, because kind of before then, there was a lot of flexibility and states were doing things wildly different. And so the ACA provided kind of like this standardization process. So as far as like what states have control of, there is a little bit of wiggle room, and Texas continues to be the most conservative. Like our eligibility criteria is the strictest in the nation. We cover the least amount of people we possibly can. So I think in large part, there's probably not a ton that can be done. Where there is wiggle room is like, you know, things about like the asset test for SNAP, which I know Feeding Texas has worked on, and they might mention in their presentation too. But where there is wiggle room is where we try to engage in advocacy. But it is not, as there aren't as many options as you might think.
Yeah, thanks, Diana. And I will say that because there are folks on this call from all around the state of Texas, make phone calls, like not as sisters, but like get your clients, get your patients to make phone calls. Like there are people in districts that are, you know, like far outside of the kind of like the places where Texans care for children and every Texan kind of traditionally work, you know, like if you're in the Panhandle and or anywhere and you have perhaps like a Republican representative there, they need to know if this is affecting you, if it's affecting your patients and the people who you're working with. And it's hard for organizations to make those phone calls because you know, if we're not represented by that representative, then it's hard to really like get a foot in the door. But constituents totally can. So if the policies that are connected to measuring income or to the long wait times are affecting you and the people who you work with, like share your local representatives' phone numbers, get those folks on the phone with the people who are in their state, in their like who represent them in the state house, and complain. Complaint is also such a powerful mechanism, and I just want to make sure that like that's on the table too, because yeah, without like lots of voices really focusing on how inequitable and how clunky and slow these policies make our access to healthcare in Texas, then it will be a longer and slower road without that type of advocacy. And so, yeah, I mean, you know, there's lots of opportunity to talk about how to do that. We don't have a panel about that, about like, you know, patient and constituent advocacy on the Texas State of Enrollment this year, but we can always do a primer in the middle of the year and invite everybody and have a long chat about it. So thank you so much, Diana, for this part of your presentation. We do have more questions, but we're going to move on to the rest of the panelists for right now. And hopefully we'll have some time for coming back together and answering more questions at the end. So thanks everybody for your contribution so far. And for now, we will move on to Amy Cuellar from Feeding Texas.
Good afternoon. And Lynn, I'm going to a little bit address what was just a question from the SNAP perspective. On SNAP, when people are applying and they live with other individuals, what is looked at or should be looked at, and when we help them apply, then we should look at the people in the household. If someone is applying and they are unrelated to other members in the household, meaning maybe they're staying with a friend temporarily to be able to have a place to stay, but that person is just giving them a place to stay. They need to provide their own food. Then you're looking at the person applying is the person that plans to purchase and prepare their food individually, and they don't necessarily need to be a part of the household. On the other people in household would be the other individuals living there. If they do not have any relationship, biologically to the other people in the household, they can apply just for themselves for SNAP, and the income and resources would not be considered for the individual applying and who plans to purchase and prepare their food once they get SNAP. Now, parents and children have to be one household unless the child is 22 or above. And husbands and wives have to be in one household. So I hope that helps. It makes a big difference when you're helping someone fill out an application to understand that. And maybe that'll clear that up for a little bit for SNAP. There's other rules, but that's primary households are relationship based if they have to be together, and that's parents and children, and then husbands and wives. If a child is 22 or above, they can apply on their own, even separate from their parents. Okay, Lynn, if you'll go to the next slide, please. Okay, what I've got here is a little information that a lot of things are going into play that affect us starting this. These updates are all effective what we have information on as in September. The bulletin from HHSC for the October new income limits and so forth has not been issued by HHSC as of about an hour ago. I have not been able to find anything on their website, nor has their October revision, but that's coming. I've got some federal guidance here in a minute we'll talk about that'll give you some updates, but just to kind of share, you can go to Google and enter Texas Works bulletins, and the last one issued was August 12th. And we should see the October updates coming out just any day. Let's go on. All right, there's some policy effective October 2024, October 1, that are changing some work requirements for individuals that are a little bit older than what we're used to seeing. And so let's talk about that, because within the last year, we've had some major changes for able-bodied adults without dependents. I am technically, if I were applying for SNAP, an able-bodied adult without dependent. I live alone. I don't have anyone depending on me. So if I were, let's just say I'm 53, I love being young, so okay. We'll look at that for a minute because some things are changing. So work rules for SNAP employment and training say that unless someone is exempt, they are required to follow and meet work requirements to continue getting SNAP benefits longer than 3 months. ABODs have a limit of 3 months with some other continuous possibilities in the future, but the work requirement is met either by working or participating in a work program at least 20 hours per week, or receiving pay a federal minimum wage equivalent to 20 hours a week in each week in the month. So that is a little bit of the SNAP work rules. And if you've never looked at the form in the Forms Handbook for Texas Works, Form H-1808 goes over those work rules, and really any individual between 18 and 59 should be given a Form H-1808. It just educates them that they have to follow work rules if they're on SNAP. So keeping in mind what makes meeting the requirement, that's working or participating in work for 20 hours per week, or getting paid the equivalent of minimum wage. Minimum wage is $7.25 an hour, and they have to do it at least 20 hours per week in the month. Okay, let's go on to the next slide, because there's a lot of individuals that are exempt from SNAP ABOD work rules. If they meet any of these particular exemptions, is the first one's being pregnant. That is an exemption from the SNAP ABOD work rule. Also, living in a SNAP household where someone is under the age of 18. That would be like the scenario I talked about me. only I have a 16-year-old living with me. I'm 53 and I have a 16-year-old. That's the equivalent of having a dependent in my care. So that is something that would make me exempt from work requirements. Other policies is being under the age of 18 or effective September 1, 2023, be over the age of 51. That is the first time, September 1, 2023, when the age requirement raised. It went from 49 to 50. Then effective October 1, 2023, it went for being over the age of 53. So it went up to, ABOD policy went up to 52. And then now coming into play in the next week is effective October 1, 2024. You have to be over the age of 55. Remember, I made myself 53 for this scenario, so I would be falling into the work requirement if I were on SNAP. Very important, and that's an education we need to make sure when we're doing App Assist with clients to make sure they're aware that that requirement is in place effective next week. It will impact many people's lives. And I'll share that because once a person is certified, 2 days later, Texas Workforce Commission, working with the 28 workforce boards across the state, sends a communication to the client that they need to come in for SNAP orientation, work orientation. If they miss that appointment, they immediately become sanctioned. So that increase in age goes from what we had up to through 52. Now it's going through age 54. And that's a big impact for a group of people that some of them may not be working. And so they're going to have to follow through on the work requirements. Another exemption is being a veteran. Now, let me clearly explain something. That does not mean that they retired from the military or that they were honorably discharged. If they served an active military time frame, made their commitment to the military, even if they were discharged, that does allow them that exemption. Also, being homeless, and that's very crucial. There are some guidelines that we'll look at there, but being homeless, regardless of the age, is very important. And another group of individuals that we are not usually impacted so much with SNAP, but being a former foster care youth who is under the age of 25. So that is something that is very important to be aware of, and that allows for exemptions from the work rules that normally come into play that are shown on the Form 1808. And that extension of the age through 54 goes into effect October 1. So we're talking in 6 days. All right, let's go to the next slide, please. Now, this is the definition of homeless individuals, and those are identified by the state as people who don't have fixed and regular nighttime residencies. They could be living in a supervised shelter designed to provide temporary accommodations, a halfway house or similar institution that provides temporary residences for individuals that are intended to be institutionalized, a temporary accommodation of not more than 90 days in the residence of another individual. Maybe they're couch surfing and they are staying on a friend's sofa, but they've told them can't stay more than 3 months. So that would be a homeless individual, or a place not designed for ordinary use as far as regular sleeping. A hallway, a bus station, a lobby, similar place. It might even be a storage unit. We often see that as homeless individuals. And then let's look at the definition of veteran. I verbalized one, but let's look at what HHSC has indicated. It means an individual who served in any United States Armed Forces, such as the Army, Marine Corps, they're all listed there, including an individual who reserved in a reserve component of the Air Force or Armed Forces, excuse me, and who was discharged or released therefrom, regardless of the reasons or conditions of the discharge or release. And then a little more clear definition on the foster care youth is for those age 24 or younger, and those are individuals who have been in foster care either through the state, a district, territory, or Indian tribal organization as of their 18th birthday or later, and who is under age 25. We have tribal organizations here in Texas, so be aware of that. They could be have been in foster care in any of those organizations. And this is all ways that people could be exempt from work requirements for SNAP. Let's go to the next slide, please. This is something that came into play about a year ago. This is related to policy that unless we hear something new, we have a policy that is ending on September 30th this year, and that is the replacement policy for SNAP for people whose cards have been scammed and the benefits were fraudulently taken off of SNAP cards for anyone that had these transactions occurring October 1st, 2022 through September 30th. That policy was a part of Texas Works Bulletin 23-10, and it is at this point, to my knowledge, has not been renewed or been approved to go further, and it can be, but it would take federal approval. So that is something just to be aware of, because there are still periodically scams going on where someone's cards are wiped and their benefits are no longer available to them. So just letting you know that's something that's coming to an end, and we'll wait to see. Hopefully that'll get approved to be extended by Food and Nutrition Services. All right, let's go to the next slide. Okay, SNAP interviews. You know, through the pandemic, and we had a very wonderful experience where SNAP interviews were put on hold. And effective June 1 of this year, they were put back in place. And that means that HHSC on apps and recertifications will have to have an interview. And HHSC should interview either through lobby walk-ins or by making at least 2 cold call attempts. And if they are unsuccessful in the cold call to the client, HHSC will mail the client an appointment notice, which is Form H-1830, application appointment notice, that provides the applicant with a way to contact the agency with a flexible appointment interview. That is usually referred to as the interview line, where clients can call in through the contact information on the Form H-1830. So I think the biggest thing we can do to help our individuals that we're assisting is to make sure they know to answer the phone when they get called, because they're going to have 2 attempts and then it's considered a missed appointment and they have to arrange for an appointment. And if they can answer the first time, that will speed up the processing of an application. All righty, let's go to the next slide. Yes. This is the reference I made to cost of living adjustments for FY25. And this is something that goes into place for SNAP every October. I've been working with SNAP policy and working in SNAP delivery since 1985. And this is something that has continued to be in place in October. So what I can share with you, because the specifics in the Texas Works Handbook have not been released, but based on the Food and Nutrition Act of 2008, there was a cost of living adjustment made for October 1, and the maximum allotment for a 1-person household is $292, which is up a little bit. The minimum allotment for a 1-person household remains at $23. So just to kind of share that, and we can look forward to seeing in the Texas Works Bulletin some of this information with the income limits listed coming effective October 1, and usually they're released sooner. In addition, there will be deductions, updates, and so forth that will be shared in that same bulletin. So that's coming from Texas Works Health and Human Services. I think that, yes, this is an exciting one. And I'm going to use the acronym DOS. HHSC started a process of direct application assistance, referred to as DOS, effective August 26, 2024. This is specific only to Health and Human Services community partners, where they can assist clients via the phone as long as they can receive text and emails and have access to the internet. So this is very exciting. This allows us to assist individuals that might not be able to get to a pantry or to a community partner office. As long as they can access the internet and a text or an email, this would allow us to help them online. It's very different in what we normally see as far as an application assist, but it's not hard, and it is much easier for the client, especially those that we in the past would have had to mail an application to and have them return it. So this is kind of an exciting thing going forward with our community partner program that Feeding Texas works with and the food banks work with. So just wanted to share that. It's new, it's innovative, and it is allowing some options for those community partners to work with individuals that are more homebound, as long as they can answer a text and access through maybe their cell phone, the internet. I believe that's all I have, Lynn.
Yeah, just those magnificently important updates. That's all. Thank you so much, Amy. And I know we've got to move on to other panelists, but if you don't mind just answering one quick question, and then hopefully again we can get to some others at the end of the panel if we have time.
Okay.
But what if people get SSDI? Do they still have to meet the work requirements for SNAP?
You know, that's an excellent question. And if they are on a Social Security approved disability, you can be exempted from work requirements.
Mm-hmm.
They would just need to make sure they share that with the eligibility specialist that does their interview. And those individuals should know that 100% VA disability or any disability identified through Social Security meets a total exemption from work requirements for SNAP.
Cool. Good stuff. Well, I can't wait for that bulletin to come out. That's like the nerdiest thing I've said all day. I'm so excited for the SNAP bulletin, but I am, and excited to look over it with you too. All right, and so next we've got Catherine Strandberg from Everybody Texas, who will talk with us a little bit about the Healthy Texas Women Program. Catherine, thank you so much for being here.
Yeah, I'm so happy to be here, Lynn. Thanks for having me. So I am going to talk about the Healthy Texas Women Program, its current status, and some things that we're anticipating happening in the next couple of months. If you want to give me the next slide, please. So before I go into that, I briefly wanted to talk about Title X. Everybody Texas is the primary Title X grantee for the state of Texas and the largest Title X grantee in the country. And broadly, what that means is that we support a network of 175 clinics, or 157 clinics across the state of Texas to provide basic preventive healthcare services around family planning. And that includes contraception, testing and treatment for sexually transmitted infections, basic fertility services, and preventive cancer screenings. And so a lot of the agencies that we support are agencies that you are very familiar with as enrollers. We have a huge number of FQHCs in our network, Federally Qualified Health Centers. Sorry, I'm trying to avoid acronyms today. And what that means is that regardless of payer source, hometown, or income, you are able to access these high quality services on a sliding fee scale for low to no charge. As you can see, 73% of our clients are below the poverty line, and 56% of them are uninsured. Next slide, please. So Diana touched on this a little bit earlier, and it's funny because we have slightly different numbers for the number of reproductive age women who need publicly funded family planning services. If you expand the age range out a little bit more to cover 15 to 44, it's 1.9 million women. And just to give you an understanding of what an incredibly high number that is, Diana was saying, 1 in 4 women of reproductive age is uninsured in the state of Texas. But what that looks like is if every single person in Wyoming, Vermont, and Alaska did not have any access to health insurance, that is the number of people that we are talking about who don't have access to health insurance or Medicaid to seek basic preventive healthcare services as healthcare issues arise for them. Next slide, please. And so beyond Title X, if we're thinking about sexual and reproductive healthcare, women's preventive healthcare services, there's a couple of layers of a safety net where folks can access services. Diana touched on this, but by and large, folks who are without insurance often only see regular access to a physician and full access to healthcare when they are pregnant and now within that year after their pregnancy, right? And so there are 2 main other programs that serve folks with preventive healthcare services around sexual and reproductive healthcare needs that they're not really health insurance, right? They're a limited benefit program. And those are Healthy Texas Women and the Family Planning Program. Healthy Texas Women, as you know, because you've helped so many people with these applications over the years, folks on these calls, is a program that you enroll in. And so you are a member of the program and you have specific benefits because of that. And the Family Planning Program operates a lot like Title X, where you have a grant given to you as a clinic and you spend down that money based on folks who are eligible for those services. But you don't enroll people in the program per se, right? So in 2022, there were 170,000 women served by Healthy Texas Women and 113,000 served by the Family Planning Program. These numbers are a little out of date. We just got new numbers from the state, so I should have updated my slides before this presentation, but I didn't get around to it. Next slide, please. And then the other safety net program that I wanted to be sure to mention is breast and cervical cancer screenings. Serves low-income folks with breast and cervical cancer screening and diagnostic services. And it's a relatively small program. It served 30,000 Texans in 2022. And then we already know all about Medicaid for pregnant women. Next slide, please. So who is eligible for Healthy Texas Women? You have to meet quite narrow eligibility criteria to be enrolled in this program. You have to be between 15 and 44. If you're under 18, your parents need to consent to your enrollment in this program. You need to be at or below 204% of the federal poverty level, a Texas resident, already uninsured, not pregnant, and importantly, you need to be a US citizen or qualified immigrant to access these services. Next slide. So what is covered by this program? So as I said before, Healthy Texas Women is not health insurance, but it's a defined benefit program that covers basic preventive healthcare services. So that includes pregnancy testing, pelvic examinations, sexually transmitted infection services, breast and cancer screenings, exams, mammograms, screening and treatment for a specific suite of conditions that impact the health of pregnancy, right? So cholesterol, diabetes, and high blood pressure, because this program was initially founded to alleviate some of the maternal mortality challenges that Texans have seen persistently over the last several decades. Also HIV screenings and all FDA approved methods of contraception. Next slide. So a little bit of history about this program. Healthy Texas Women really came out of a moment in Texas's political history in 2012 and 2013, where the state made enormous cuts to the safety net. They cut the family planning budget of the state by 2/3. And when that happened, I think everyone on the call can understand this. When they cut the family planning budget by 2/3, we saw a ton of clinic closures across the state nearly instantaneously. Our Medicaid birth rate skyrocketed. Everyone got chlamydia, like really obvious impacts from closing down a really important access point for preventive healthcare services. And so in the face of those numbers, the state government really scrambled to make up the difference and support some access to preventive healthcare services. And in doing so, created Healthy Texas Women. So they created the program in 2015, and the next year they applied for an 1115 Medicaid waiver program for family planning. And what that means is that the federal government allows you to draw down some money for a program, and in return, Texas has to align itself with some federal regulations around this. So the application was pending for a very long period of time between 2016 and 2020, when the waiver was approved by the Trump administration. And importantly, that waiver approval included a piece of language that was important to Texas at the time, which included an exclusion of abortion affiliates, namely Planned Parenthood, which is a violation of Medicaid law. Medicaid includes a provision for what's called freedom of choice of provider, which means that folks who are enrolled in a program are free to choose their provider of healthcare. And the exclusion of Planned Parenthood, which goes all the way back to 2012, has been an important policy for Democratic presidential administrations to hold up, but has also been a very important policy priority of Texas leadership to keep that exclusion in place. So moving into this year, the waiver is now up for renewal again in front of the Biden administration because they're 5-year projects, right? So it was finally approved under the Trump administration, and now we're having the same conversations with the federal government. Next slide. So because, as I mentioned, the waiver is up for renewal, and Texas has made the policy decision to exclude Planned Parenthood from the program, it's possible that the Biden administration will deny the application. My clinical network and other women's health providers across the state have really urged them not to do that, for fear that any cuts or changes to this program will land us back where we were in 2012, with enormous cuts to the safety net in Texas, and clinics closing, right? So that is what we're incredibly worried about. We're incredibly worried about the network of clinics that already exists being forced to close if this money were to go away. So we're looking at 2 possible scenarios here. One is that the waiver is approved and the program continues as planned, and that the challenges that we currently see in the program related to the application, which I'll get into in a minute, remain and become sort of central to our advocacy work around this program moving forward. And the other one is that the waiver is denied, or that the administration chooses just simply not to approve it, right? And Texas loses out on that federal funding, again, potentially returning the family planning network in the state to a state of crisis similar to 2011. Next slide. So that is like a big, heavy update from me, because Healthy Texas Women is a major source of funding for our clinical network and cuts to federal funding represent an existential threat to care in the state of Texas. So my ask from all of you who are on the ground that you're talking to folks every day is to advocate for the importance of this program and share stories about this program with advocacy teams like ours. I'll make sure you have my contact info. But anytime you're able to enroll someone in HTW and they're able to get life-saving care, that's the kind of story we really need right now as we advocate for the future of this program. And then on the flip side of this, which I also wanted to focus on a little bit, is that I know that there are big challenges in this program, especially for folks who do enrollment support, right? So when this program was entirely funded by the state, there was a very short application where you could sort of self-attest your eligibility for this program. And now that it's an 1115 waiver program, it has to be compliant with federal regulation to screen folks for Medicaid. And that is very challenging, right? Like we know that there are so few people who are eligible for full Medicaid in the state of Texas who are adults, and screening them for that is a pretty onerous process. It's a long application, and y'all work tirelessly to get people through that application. And so as the dust settles around this really big existential threat, whether or not the waiver will get renewed, we are turning our focus to, regardless of the future of this program, what an application for family planning access looks like that is, easier to navigate, is appropriate for the kind of services we're talking about, right? That is ideally 2 pages long and is much easier to understand both for clients and folks helping them through that process. And yes, there's my contact info. Please feel free to share any stories with me. I would love to hear them. And I think I'm at time.
Thank you so much, Catherine. Yeah, we definitely have some really good questions. Thank you so much for these updates. We're getting kind of close to the end though, so I'm going to switch over right now to Lizette and to Allison, and then I don't think we'll have time for questions afterwards, but we will definitely follow up with you so that we can make sure we get the most pertinent info back to the attendees. So I will switch it over from here to Allison and Lizette.
Thank you so much, Lynn. So hello, everyone. My name is Lisette Galvan, and I serve as the Public Policy Director for the National Alliance on Mental Illness, NAMI Texas, and we're a nonprofit organization dedicated to improving the lives of individuals affected by mental illness and their families. Next slide. So, as Allison and I prepared for this session, we chose to focus on key Medicaid bills that impact the patients and clients you may be supporting. While the Texas legislature passed several important laws to strengthen our mental health system, only one Medicaid-related bill was successfully enacted, and that's House Bill 113, authored by Representative Ortega. So this law allows Medicaid Managed Care Organizations, or MCOs, and the STAR Medicaid program to categorize services provided by community health workers as quality improvement costs rather than administrative expenses. So this change supports greater investments in community health workers by reducing the financial burden on MCOs. So now we'll dive into legislation that didn't pass. But these bills you can advocate for during the upcoming 89th legislative session by engaging with your state representative and senators. So House Bill 465 by Representative Thiry, this bill would have introduced Medicaid coverage for doula services, enhancing maternal health support. Next slide. So House Bill 1879, Texas is facing a mental health workforce shortage, making it difficult to meet the demand for care. And this bill would have licensed marriage and family therapist associates, licensed master social workers, and licensed counselor associates to receive Medicaid reimbursement for services provided under clinical supervision. Unfortunately, as mentioned before, this legislation did not pass. And so Access to mental health care is essential, and the following bills aim to expand crucial programs for individuals in need of treatment. So House Bill 2404 is for functioning family therapy, or FFT. It's an evidence-based intervention targeting youth offenders with behavioral health issues and their families. Currently, commercial insurance covers FFT, but Medicaid does not. So this bill sought to close that gap by ensuring Medicaid reimbursement for FFT was there. Next slide. Next, we have House Bill 2638, and this is for multisystemic therapy, or MST. It's a community-based treatment for juvenile offenders who have committed violent offenses. MST addresses the root causes for serious antisocial behavior, but it is currently funded only through state, local, and foundation funds, limiting its accessibility. So this bill would have enacted Medicaid reimbursement for MST. Then we have House Bill 2337, and this is for intensive outpatient services and partial hospitalization services, which are critical for behavioral health care. Yet Medicaid currently does not cover these services. This bill would have expanded Medicaid to include both improving access to these necessary treatments for Medicaid beneficiaries, but it also didn't pass. Next slide, please. We also wanted to ensure that we covered child welfare and that it was addressed in this presentation. One bill that would have benefited the Department of Family and Protective Services, or DFPS, is House Bill 2933. Under current law, when a child is adopted through DFPS, only one legally authorized parent can consent to medical care. This bill would have allowed both adoptive parents to provide medical consent for children adopted from DFPS custody, but it also didn't pass. And lastly, youth in the juvenile justice system face an urgent need for healthcare access. And we've included this following bill, House Bill 4366, which in 2021, the Texas Juvenile Justice Department reported an average daily population of 637 youth in secure facilities and 56 youth and halfway houses. So this bill aimed to expand Medicaid and STAR health screening for these youth, ensuring that they receive comprehensive physical and mental health services during their time in the juvenile justice system. And now I'll pass it on to Allison. So next slide, please.
Hello, I will go quickly through this, but speaking slowly. My name is Allison Moore-Beaulieu, and I'm the Director of Policy at the Hogg Foundation for Mental Health. We are a grant maker dedicated to improving the mental health and well-being of all Texans. So last legislative session, more money was dedicated towards mental health than any previous session. However, it was really focused on psychiatric facilities and those with the highest level of need, rather than supporting communities. So we know that there are still a lot of challenges with getting community-based care, especially in other languages. But there were some positive things. The budget included a new grant program for children and youth. It also increased funding to multiple existing community-based grant programs. And again, had the highest level ever for state hospital infrastructure, $2.3 billion. Substance use funding remained consistent with previous sessions. Next slide. I won't go through all of these numbers, but I did want to share the breakdown of the community mental health services for adults, children, crisis, substance use, and again, those psychiatric mental health hospitals. There was also an additional bill that provided more funding for individual mental health hospitals being built in other parts of the state. Next slide. There are 6 grant programs through Health and Human Services related to mental health. each of those received a substantial amount of funding that community organizations can apply for, including programs dedicated to veterans, those with criminal justice involvement, our urban population, community mental health, healthy community collaboratives, and again, this new grant program specifically for children and their families. Next slide. That's all, and Lizette and I think we're out of time, so I will stop there.
Thank you so much, y'all. Are those grant opportunities open to sister organizations that are on this call right now? For some of them, I mean, I understand that some of them look like they're clinical, but do any of them fund community partner programs since the state doesn't?
So I would have to look more into that, but some of them are pretty broad as long as it supports prevention or intervention of mental
Yeah.
health or resiliency, but I can look more into it.
Interesting. Okay. Yeah, I have some work to do after this conference, putting together a lot of the different components that folks have been speaking about with respect to mental health care. It's not a neglected topic among this circle, right? Everybody on this call, for sure. But we definitely have seen like more, I think, money moved towards the issue in the last like decade or so. And I'd love to see if we can't kind of like get together a sort of I don't know, like a description of the network or the infrastructure or something for sisters to see like where they can really pull from for, you know, funding, guidance, advice, that sort of thing. But so I'll definitely follow up with y'all after this to see how we can kind of really beef up our support for the sister community, given all these funding packages and law changes and stuff. And yeah, we are at the end of this panel. So we have one more for today. Thank you so much again to our panelists. The last thing that I'm going to do here is I'm going to stop sharing my screen and then I'm going to start resharing it again so that we can go through that raffle that I shared earlier. And let's see here. Here's the poll. Thank you so much, Emma, for doing that. And Sonia, you would have called it out if had I forgotten it again. I'm going to minimize that. I'll share my screen one more time. And we will get to the raffle here. So same as before, if I spin this wheel and it comes up on your name, go ahead and raise your hand here in the chat function, and we'll send you a $50 gift card. I wish we could send them to everybody, you know, but funding is what it is. So I'll spin and we'll get $50 to as many people as we possibly can. Okay, Reina Lopez. Let me see if Reina is here. Yay! Oh, cool. Reina is here. Well, Reina, thank you so much for being here. And I'll make sure that we get you one of those gift cards. I'm writing your name down right now. And we'll spin one more time. Okay, Nashmatullah, cool. If you are, and you are here, awesome. Well, that was quick this time. I'm glad we were able to get through it. Thank you so much, Reina and Hashmatullah, for being here, and everybody. Again, I think that the work that we're doing here, building networks, building expertise, and really just relying on each other is really, really important. So thanks everybody so much for your participation. Thanks to our panelists again for your contributions. And if everybody is back for our 2:30 panel, we will see you in 10 minutes with Ariana Anaya from, formerly of Foundation Communities, high performing navigator organization here in Texas, who's going to share some marketplace tips and tricks with us, best practices for getting through that clunky application. And it does have new questions on it. I feel like every year it has new questions, and it has some new questions this year too. Thank you again to all of our panelists, and we'll see everybody in about 10 minutes. Thanks, y'all.